Hi everyone, a very good morning in the daily transform session. I'm Dr. Sumer and I have with me Dr. Deepti. And
Yes,
every morning we do a quick strategy or a pep up session in the morning for all our students on the daily transform series.
yes, a very good morning to all our dear students, and I hope you've been working towards your targets, and I hope that you were absolutely pushed to track in the yesterday's transform session. Yes. So we had a very special request in the transform session yesterday, as well as in our Telegram channel, and we decided to today first talk about that, and that will be the strategy that is required for third and fourth year students. So anyone who is in the third year now, anyone who's in the fourth year now, what would we really want you to do and how we will want you to do it, what would be our inputs, right, to help you, and then later we will definitely take up your queries as well. Dr. Samay, you want to start?
I totally agree. I totally agree, and I see a lot of students are, in that zone, and a lot of students have been writing to us that, sir, I'm starting my journey, and you're talking about the students who are just appearing for the exam. What about if I'm starting my journey? I'm a third year, or I'm a fourth year, or I'm an intern also, but I'm starting for the first time. Or, when you start, the first thing that I want you all to keep in your mind is content or concepts. Now, the most important thing is, like I've seen this mistake being done by many children, and I'm sure Aditi also agrees, and I think she's talked about this multiple times. Many children, when they start studying for a competitive exam seriously, they start jumping to MCQs. But if I don't have the concepts or the content, jumping to MCQs directly will not serve my purpose. And second thing is, many people have this wrong notion that I have to study separately for a prof exam and separately for a competitive exam. Both can be done hand in hand if you are using the content based approach or a concept based approach. Now, what we have done is, by me, Dr. Deepti, we have always thought of that,
How the students would think,
yeah, how
right?
the student would think, and also we've thought of like what would be the, ideal thing to be done depending on what kind of student are you. Now, we
Yes.
have seen that there are some students who are very self-learning kind of students. So, if you are a
Yes.
self-learning student,
So I think, Sumay, first let's tell them that we will be dividing all of you into three categories. All the third year, all the fourth year, and even the interns can use this, right? So we are going to divide you into three categories, and you have to see to which category do you belong, right? And therefore, henceforth, we will take it forward from that. So what are the categories that we would put these students who are currently third year and fourth year students or even interns are? The first category is I am someone who studies by self. Okay, so I'm a self-study kind of a person, and I can manage things as long as I have the right content because that everyone needs. So this is category one. Category one is for students who are comfortable with the idea of self-learning, who are motivated enough to do self-learning. Okay. Category number two is for students who feel no, if I'm left by myself, I usually procrastinate, I delay things to the nth time, and then I have to rush, right? And because of that, I compromise. So I am someone who needs a guided approach, right? So category one I said is someone who is more of a self-learning person, motivated enough, dedicated enough. Category two is someone who needs a guided approach to studies because, at least they want that, okay, this is to be done, this is to be done, this is how it is to be done. Yes. Category three, I will keep someone in the middle. Okay. So, ma'am, I am not like a completely self study person, but I'm also not someone who has needs everyday motivation. I would need something in between. So that is going to be category three. So I want everyone to take a pen and paper and see to which category do you belong, and therefore we will start talking about strategies based on this category. So I will ask Dr. Sumay to start with category one. Okay, someone who is uh, a self-learning person would be the approach for that student who is currently third year or fourth year and is a self-learning person?
I totally agree, and I think all of us are self-learning in some way or the other. But when we say self-learning, we mean, self-motivated. Self-motivated means, I just, that you don't need an external impulse to start studying. You are happy to start studying on your own. You are happy to make a schedule on your own, and you are able to follow that schedule. Now, you know, we have to be honest to ourselves when we say this. We have to be honest to ourselves when we say that, boss, this is going to be my style of things, that I'm going to be more self-motivated. Self-motivated means that you're able to make a schedule that this is the week when I'll finish this syllabus. And these are the kind of students who, are able to take out the maximum out of a recorded course. Like for example, on the dance platform, the recorded course is called as Back to Basics, which we have really updated now, which also comes with a slight tadka of live lectures, which is called as live rapid revision. So towards the end, we do a live revision on the app in the Back to Basics itself. So, at day one also you get the recorded live rapid revision, and the end of the year you get a live rapid revision. And you also have the power of the AI summarizing everything for you and asking you questions after every lecture. My question is, only students who say that they are self-learning but they are not able to utilize this properly are people who use it like Netflix. They start scrolling the lectures every day like this, and then they say, "Acha, aaj ye dekh leta hu, aaj ye dekh leta hu." At the end of 2 months, you're not even finished any subject. So my suggestion is, if you are a self-learning, self-motivated person, try to make a schedule. Use that schedule with the Back to Basics. Will make an ideal day for you also. I'll just make an ideal day also, but let me ask Deepti to add on.
So, as Dr. Sameer said, that if you are using you are a self-learning person, Back to Basics is the ideal course for you. But yes, you would need to, understand what you need to take out of it. It is all with you. It is all there. But what you take out of it is the most important thing. Now, everyone knows as far as the content goes, DAMS ka content is top notch. We've always been known for that. So, whether you are preparing for your professional exams or for entrance exams with the Back to Basics, you are, it's a go-to resource for both. What should be your target? So, if you are a third year student, your first target will be, I will first cover all the third year subjects from Back to Basics. That will be my first priority. I will not say go back to anatomy. Okay, wait for that. I'll tell you when you need to do that. But if you are a third year student and you are self-learning from the Back to Basics, I want you to start with your third year subjects itself as if you are going to do it for the last time, which means we will cover all the videos, right? Every video discussion that now the teachers are doing also comes with MCQs side by side. So you are, doing the MCQs with the teachers in the recorded lectures. There is also a section in Back to Basics called as integrated MCQs. It's a very good idea to start doing those integrated MCQ rounds as well, right? So first target is third year subjects. Back to Basics comes with everything. So you have the entire DQB, you also have the entire test series. So once you cover the videos, we want you to now go to your class test towards the, after finishing a particular subject. And what should you do with these subjects? Suppose you're doing ENT or you're doing Ophthal. At that time, we want you to do side-by-side topic-wise questions from DQB. Whatever topics you're covering, let's say you've done retina. Let's cover the questions on retina. Let's understand if you are, you are doing otitis media. Let's cover the questions of otitis media at that particular time. So topic-wise MCQs to be done side by side. Class test should be done towards the end once you finish the lectures, and SWTs should be used for your first revision, right? So whenever you are doing ENT again, we would want you to cover the SWTs also at that time. Not just this, the DQB will have a separate section of PYQs. So whenever you're doing a subject, not only you should do topic-wise MCQs, you should also be doing the PYQs of ENT, PYQs of ophthalmology once you finish the lectures. Also in the third year, it is a good idea to start covering the big subjects of fourth year. So you should start doing videos of medicine, surgery, and obs and gynae, right? So this should be my how to begin approach if I'm a third year student. If I'm fourth year, the reverse is to be done. So you will start with first your fourth year subjects, and then we will go on to other subjects, right? For fourth year again, yes, you have to start doing the daily DQB topic-wise MCQs. Once you finish the subject, we want you to do the PYQs from DQB. We want you to do your class test from your test series. Also, the test series now have entire PYP, previous year paper. So we have a previous year 2 session paper of INI. We have 2 sessions of NEET-PG. We will have 2 sessions of FMGE. Complete papers are also available. But I think when you are doing it, the lectures for the first time, you should do topic-wise PYQs. And then once we begin with our internship, we can do the entire PYP itself, right? The previous year paper. So that is the broad approach. Also, at the same time, I would say, suppose when you're doing surgery, you're a third year student, you're a fourth year student, let's say you're doing surgery. It's a good idea, like you're doing anatomy of, you're doing GIT surgery. It's a good idea to go back to the GIT anatomy lectures at the same time to make it integrated. Similarly, you can integrate other first and second year subjects as well, bit by bit, topic by topic. Yes, Dr. Sumay, do you want to add something?
I totally agree. Actually, the most important things are, I'll just put it for you. If you're a third year or a fourth year, when you are starting, you need a rhythm. And that rhythm is in the morning, 8 to 9, we want you to do 50 questions from DQB. And you might ask us which subject, this subject that you're studying. We want you to give daily around 4 to 6 hours of study from your B2B, maybe 4 hours, 6 hours, maybe 4 or 5 days a week. You may not do it every day, it is okay. But a total of around 15, 16 hours, if it comes in a week, it's a very good idea. We want you to use your Cortex AI to summarize your golden points, use the predictive test, use the weekly class test from your online test series, any subject you want to revise before your college prof or your any ward leaving, any exam coming, use the live rapid revision. And you can use, there are two options on your B2B. You will see a section called as handwritten notes where everything will be filled, a section called as workbooks where you can download a workbook on your iPad or on your pad and directly write notes there also and make it in your own style also. Now I will change the schedule for a student who is not
Category
self-motivated.
2. Yes.
Category 2. Now,
Category 2 was students who need a guided approach. They are not self-motivated. So this is the best program for category 2 students. Yes, Dr. Sumay.
so here the schedule will probably be same, but only thing is you will not make your own schedule. You will not make your own schedule. You will use the schedule that we are providing you. So you will have a daily 4 to 6 hour lecture happening in the Ultimate Live. It happens at 5 p.m. and it covers all 19 subjects in a period of 6 to 7 months. Then it repeats again. And so suppose somebody is in third year and you take a 2 year subscription, you will have 4 cycles of live classes happening for you. So it is not necessary to attend all the classes in one cycle. Maybe you might do 5 or 6 subjects in one, 5 or 6 in another, 5 or 6 in another, and you can do it with ease, having a lot of off days that you might need in a third year. Any subject that you are attending live, you will use the daily MCQs in the morning. You do 50 MCQs in the morning. In the live class, you can ask your doubts, interact with the teacher. It will feel just like a face-to-face classroom because you have a teacher live sitting with you. And plus, you also get access to back to basics. So anything
Yes,
that
that is exactly what I was coming to.
you will have here also, you will have back to basics, live rapid revision. All those things are also in your access because you are in a tier above. You are in the topmost tier. So the advantage of this is that if there is a college ward living, college exam, you can use the back to basics to synchronize the schedule accordingly. Again, you will use Cortex AI, weekly class tests, and workbooks, handwritten notes. You will use the same concepts that we were using in the B2B subscribers.
And yes, as Dr. Sumeer said, App Live is like a combination. So it gives you back to basics also right from day one. You have all the recorded lectures, plus you have live classes every day to give you the rhythm. A lot of students only need a rhythm. right? So at 5 p.m. there is a live class where other students are joining in. You have instant doubt solving. You have a schedule to follow. And as Dr. Sumer said, the beauty is that you need not attend everything in one go. Suppose, you've taken a 1 year course and there are going to be 2 cycles. So maybe in the first cycle you decide, yeah, chal, I will attend the fourth year subjects. In the next cycle you decide, chal yaar, I'll attend the other subjects now, right? So this is how it can be done. So it is a cyclical course. All subjects keep coming in rotation of 6 months, right? So there will be one cycle of 6 months and another cycle of 6 months. So for example, if you take a 2 year course, you will actually have 4 cycles of live classes, and you can easily divide your subjects, that I will cover fourth year first, then I'll cover third year in the live. And at the same time, if you want to go back to, let's say, a second year subject, let's say you want to revise some particular thing about path, you have the entire back to basics by the same teachers who are teaching you live. That's the beauty. So it's not a different set of teachers, it's just the different presentation of the material depending on whether you are a self learning student or you need a guided approach.
And also, the important thing about the app live course will be, which we call as the ultimate live course, is that, there is an opportunity every single day to ask your doubts. Right?
Yes.
And there is a section on your app page which says schedule. You can just click on the schedule, see the upcoming lectures. And suppose I wanted to ask something to the teacher, there is an opportunity you can just ask during the class that, okay, CVS is going on, I will solve my CVS queries. And also, the more beautiful thing is you have an opportunity to see what others are asking. Sometimes you may not have a doubt, but others may have a doubt. And you feel as if you're in a classroom because you can see what others are asking, you can ask, you can have a poll. A lot of things happen during a live class. Now we come to third category. Third
Yes,
category of
just a recall on what the third category was. Third category of students are who need a hybrid between the two things, which means they are not exactly self-learners, but maybe they don't want to attend a class every day. They say some interaction is good, okay? So maybe like once a week interaction with the teachers so that they are pushed for next 1 week and then they have another interaction, and in after one interaction you are going to self study, then you have another interaction, then again self study. So it's like a hybrid between the two.
So for them, I have made a schedule called as the test and discussion. So test and discussion pan year, every week a test and discussion is happening. Again, there are 2 cycles that happen in a year. So you get an access to 2 test papers, every subject discussions, and these discussions are not like a MCQ discussion. They're like a subject discussion. So what a teacher is told is using these questions in the single day of
It's like
discussion
a retrograde revision of your
trying
entire
to
subject.
revise the entire subject, the most high yield subjects.
Yes.
So now you don't need to make your own schedule. You will follow the TND schedule. And you will study primarily with back to basics. Back to basics is included in TND.
Yes, that's
Right?
again
Representation
the
is
beauty of
included
it.
in TND. So your B2B and LRR are included in your TND. You study with self-learning mode. You have the AI tools, predictive test,
And
class
you
test.
have a schedule as well, right? So you will know which test is upcoming and you can study accordingly. So this is like an excellent thing for interns. So majority of times interns belong to this category, right? Where they don't have time for class every day or they're too tired to do it every day. But yes, some interaction is needed to keep them motivated, to doubts, solve their doubts, to see whether whatever they're learning by self, right, जो भी वो self learn कर रहे हैं, are they able to apply those concepts into MCQs or not? So there will be MCQ developing skill there. There is application of concepts. There are updates, and there are various methodologies which we tell you to keep pace so that even with whatever little time you have in internship, you're able to do some self study also, and you're able to do some self assessment also. Okay.
So, what we believe is that if I'm studying from home and I want to study on the mobile app, these are the things that you should be doing anyhow. Even if you're studying from home, you can't study like a Netflix. You need
Yeah.
to study as if you're studying in a real classroom. You need to balance out MCQ practice, testing, concept building, and you need to make a schedule. If you can make your own schedule, go with back to basics, which is the first tier where you get all the recorded lectures, all the AI tools, all the test series, all the question banks, everything. But important thing is you also get live rapid revision in B2B, which you have the recorded version on the day one, and towards the end of every year, there is a live version also happening. Plus, another good thing about B2B will be, which is very important, that it gives you the the liberty to study as per on your own college schedule. Like something is happening in the college, you want to just see medicine, you want to see surgery, you can do that. A tier above that will be test and discussion, which is primarily B2B with
Yes.
a weekly test and discussion with the teacher. Again, happening pan year, you can ask your
In a
doubts.
cyclical format.
You can
All subjects will come cyclically twice in a year.
all live courses on the dance platform are cyclical. Once the cycle is over, it again repeats. So in a 12-month subscription, you get two cycles. And above that will be the ultimate live or the app live, where you get the advantage that a teacher is coming on your phone every day. I believe, this is my creation. So I believe this is something which can guide, like you see. So if you see in your college or in your own assessment, there are students in the top bracket which will definitely go for T&D. There are students who are in the top bracket who might just do a B2B and still manage. Students in the medium bracket would tend to go again for a live interaction. They would like to add some live interaction to make sure that you are,
Yes.
building your concepts. But you are in the lower medium and lower side of your course. Full live would be the game changer for you
Also,
because
I want
you
to
don't
add
know,
something to
because you
this,
may
Dr.
not know
Sameer.
what is your weak subject. You may not know what is your weak
I
subject.
also want to add something. There are a lot of students, when you are in a college, you know कि आपके college में शायद कोई teaching नहीं हो रही है, right? And there are plenty many like that, right? If you feel that in the college there is no rhythm at all, है ना, लेक्चर्स का कोई रिदम नहीं है, एटलीस्ट कोई तो रिदम होना चाहिए ना बेटा. सो इफ देर इज नो रिदम एट ऑल, देन आई थिंक अल्टीमेट ऐप लाइव, द डैम्स ऐप लाइव इज द गो टू रिसोर्स. At least it will give you some rhythm. If you feel there is some rhythm in your otherwise routine life, then yes, the recorded lectures of B2B may be good for you, because then all you need to do is read by yourself, right? And passively keep doing it. As I said, if you want a hybrid version of this, it's a TND. You have the recorded version, but you have once a week live interaction with the faculty, right?
And we believe that even if you don't have the quality faculty in your medical college, if you don't have the quality faculty in your medical college, then also this ultimate live will be the,
Yeah, that's what
cover
I'm
up for
saying.
you. You will have a faculty with you every day. You will never miss that. I don't have a, many colleges are short of faculty nowadays, so you will not have the problem. You're studying abroad, but you want to study at the same level as the best of the best colleges in India. Ultimate live will be the game saver. So if I'm a third year, I might be more tempted towards the ultimate life because I don't know the subjects. I want a better guidance throughout the 2 years that I have. If I'm an intern, I might be slightly more pushed towards the TND because I do not know when my postings will end and what would happen. So if you're very busy internship, I might be pushed towards the TND. But if you're beginning at any stage and you have time at hand, these are the three options to look at for on the DAMS platform. Like, am I a
And we have the same faculty everywhere. So whoever is teaching in dance face-to-face classes is also teaching you in the app live, is also teaching you in the back to basics. So it's all coherent. They are the ones who are also making your test papers, whether it is a class test or a subject-wise test. They're all made by the faculty, whether it is a grand test, a mock test, smaller tests that we are doing like MIQ, right? So हर चीज same faculty दे रहा है. So they very well know how to train you over a period of time. So it's, and what is the beauty is our content. It is absolutely concise, crisp, but to the point. It covers everything that you need for your professional exams, for your vivas, for your entrance exams. So ऐसा नहीं कि आपको prof में कुछ और पढ़ना है और फिर internship में आके suddenly कुछ और पढ़ना है. No, you've been doing that right from your professional years. So when you come into the internship year, you're already very confident. Yeah, I've read this thing twice. All I need to do is practice MCQs now, give some tests now, have a schedule, and that's where TND merges like a fit, right? So our content is like the content which can be done multiple times. It's easy to recall. It's like, it's the dart which hits right in the center. It's what you need. It's not all around it, right? It will be from standard textbooks. Everyone knows what we teach is the gold standard, right? Everybody will change answers according to what we teach. So it would be from standard textbooks. It would have all the updates. We will cover all the guidelines, whatever is required. So it's a step by step process of uh, enabling you to do your best, right? Because you have the caliber. All you need is a guided path, right?
In the next 2 3 days, we will be, announcing a very big announcement will come up, and we'll be changing a lot of,
Yes. No,
beefing up,
sure.
not change. We will be adding a lot of things for you.
We will be
So
bringing something great for everyone, and I can just say, wait for the new dance. Okay. Anyways, right.
And also, so what I wanted you to know is, either of the options you select, back to basics, Ultimate Live, which is the app live version, and test and discussion. All three of them will have back to basics videos, both in English and English. All three of them will have the question bank, test series, live rapid revision. So these are common features for all.
I want to
The
answer a query in the
important thing
chat.
is, I just let me finish, Rodri, one second.
Okay.
Important thing is, in the back to basics, the only live component will be the live rapid revision. In
Yeah.
TND, live rapid revision will also be there. Plus, you will have every week one live test and discussion happening.
Test a
Ultimate live,
discussion.
everyday live teaching will be happening.
Yes. Okay, there is a query, user 674 is asking, or she is asking, will back to basics be good enough for USMLE? Absolutely yes. Back to basics is good enough for any exam. You name the exam, whether it is UPSC, whether it is USMLE, whether it is your prof exam, whether it is your Viva. I promise you the teachers are going to ask you कहाँ से पढ़कर आए हो. You will see the change. जो अभी teachers आपके बोलते हैं, नहीं बच्चे पता नहीं क्या पढ़ते रहते हैं, इनको कुछ नहीं आता. You will see that, why we actually call it as back to basics, the recorded videos is, when we teach, we are teaching right from basics, building you up to your clinical level, right? So we will start from applied anatomy, we will integrate physio also, we will integrate the relevant drugs also, we will include the clinical presentation also, and we will include finally what the management would be. So we would like teach you right from basics. We don't judge our students. And the content, as I said, is from all standard international textbooks, the textbooks which you are really supposed to read. So, even if you don't, it is okay. But yes, if you go through the lectures once, you will find going through textbooks becomes so much easier. राइट, क्योंकि अपने आप पढ़ने में ना टेक्स्ट बुक में बहुत इनर्शी आता है, इतना बड़ा पैराग्राफ होता है, यू डोंट नो व्हाट इज द टेक होम मैसेज. Once you attend the lectures, you have the notes, the paragraph becomes so much easier for you. Yeah, this was the take home message. This is the latest recommendation. This is the algorithm that I have to follow. Right? In fact, we will tell you, यार ये वाला टेबल हैरिसन का हम लेकर आए हैं तुम्हारे लिए. This is directly from the book. This is what you need to know. This is the table from Williams Obstetrics. This is what I want you to know. We'll highlight things for you. The purpose is to give you content which is from standard textbooks in a format which is not just doable but also understandable. It's not rote learning. It is understanding concepts. And you see how excited I get when I talk about how we teach, because this is what our passion is, to make it easier for you, to make it doable for you, to make it something that you are able to do multiple times, to engrave it into your DNA, right?
अच्छा, बहुत सारे ना बच्चे पूछते हैं, सर क्या रिजल्ट फेस टू फेस से आता है, क्या रिजल्ट ऐप लाइव से आता है, या फिर रिकॉर्डेड से आता है? जस्ट गिव यू एन एग्जांपल.
तीनों से आता है.
इस साल में ना डैम्स ने एक ऐसी चीज प्रूव की है जो शायद मुझे लगता है नहीं कोई कर पा रहा हो. थर्ड रैंक इस बार इन्हीं सेट में हमारी 3 साल की फेस टू फेस बच्ची है. फोर्थ रैंक हमारा ऐप लाइव स्टूडेंट है. एंड वी हैव
Right.
विद ऐप लाइव क्रिएटेड अ कोर्स व्हिच इज एज गुड एज अ फेस टू फेस क्लास, क्योंकि हर दिन टीचर लाइव बैठा है, हर दिन डिस्कशंस हो
Yeah.
रही हैं, हर दिन बात हो रही है. सो व्हाट वी हैव डन इज we have created a course where a rank 3 is a face to face, rank 4 is a app live course. It is blending like seamlessly, same teachers, live teaching. And plus, don't get confused, many people will confuse you. कि सर जो लाइव क्लास होगा वो मेरा मिस हो जाएगा, नहीं, लाइव होने के बाद उसका रिकॉर्डेड वर्जन वहाँ सेव हो जाएगा।
यस,
सर लेकिन पहले दिन
सब
तो
कुछ
सारे लेक्चर
मिलता
नहीं
है।
मिलेंगे। ऐसा नहीं है, पहले दिन भी बैक टू बेसिक्स पूरा एक्सेस आपके पास होगा। ये कई लोग कंफ्यूज करेंगे आपको बिकॉज ऑफ देयर ओन वेस्टेड इंटरेस्ट।
And
एंड
I want to
ऑल्सो
specially add
एक
as a
एक चीज
commitment.
एक चीज मैं कहना चाहता हूँ, पूरे लेक्चर के अंदर ना मैं गारंटी करता हूँ, डैम्स के हर लेक्चर जो भी आप 3 से 4 घंटे का कोई भी लेक्चर अटेंड करोगे, आपको कम से कम 10 बार यूरेका मोमेंट होगा। 10 बार ऐसा लगेगा, वाओ, ये अब मेरे समझ आया। हर दिन ऐसा होगा आपके साथ,
I
हर दिन,
know.
ये गारंटी
And
करता हूँ।
I promise once you do the B2B recorded versions or app live, whichever you are comfortable with, and you go for your prof exams, I promise they are going to ask you kahan se padh kar aaye ho. They will be proudly asking that, not in a nagging way, and then you will think ki yaar kya bole, right? I promise. So I've seen boys being asked this in their OG vivas, how do you know so much? या उनको बोला जाता है तुम ऑब्जन गाइनी ले लेना. And same things for girls. Surgery, you will be like no more bias, right? You will be good at everything. Plus, you will have a way to write your answers in your professional exams. Your theory is also sorted. Just open the B2B notes and see how we give it. हम ऐसे पढ़ाते हैं. What is the definition? We even teach you small things like definition में क्या part important है. We will teach you risk factors. We will teach you pathophysiology. We will teach you, what are the key things in the management, the algorithms, and same to same you can just go and write in your theory exams. So whether it is your prof practicals, whether it is your theory, whether it is your cent-ups, when you want to really revise quickly, you have your live rapid revision, you have Cortex AI, go through these points. They are the ones which your teachers might be asking in your vivas, and then you will see, अरे यार जैसे पढ़ाया था उसी सीक्वेंस में वाइवा में भी क्वेश्चन आ रहे हैं. And that's when you will really feel on top of the world. And believe me, when you enter your internship, you are sorted. All you have to do is test and discussion. Test करो, गलतियां पकड़ो, revise करो. Test करो, गलती पकड़ो, revise करो. Right?
And plus,
So,
we also have a lot of free resources on the app. As soon as you download the app, you get an access to a daily quiz, which is free of cost. You will have a everyday 5 question quiz happening. Sometimes it is on a theme, sometimes it is not on a theme, but every day a quiz is happening. You can compete with rest of the country. Every day there is a case of the day posted. You can analyze the case, post your answer, interact. So these are some free things that are happening on the app all the time.
currently all
Along with that,
transform 10x
along with
tests
that,
are free.
al- along with that, in the test series and in the question bank, in the videos, there are a lot of content which is unlocked for you. And a lot of times you're doing a lecture on YouTube and the test is there on the test series
App.
unlocked. So just be on that, to be on that zone, please follow us on the channel. Do subscribe to the channel so that you don't miss out on any such important announcement. Do follow DAMS on the Telegram so that you keep getting to know about any such
DAMS
activity.
की test series is not something that you should be missing. If you want a realistic approach onto what exactly is asked, how options are created, our tests are closest to the real exam, whether it is a GT or it is a CBT or it is mini class test or subject wise test, right? Test series is a must to do. Theory or MCQ, दो अलग अलग भाग हैं, and you have to ensure that you're doing both, right? So that is why I said when you are doing the lectures side by side, do DQB. But once you finish the subject, switch to test series. There is a 7-level testing in our test series. There are right from 20 MCQ test to a 75 MCQ test to a 200 MCQ test. There are various tests that are available to complete PYPs, previous year papers, are also available in the test series. So there is a
Also, I would
7-level graded
recommend,
test.
also on the test series, you will see specially curated test for foreign medical graduates, specially curated test for
Any test,
NEET-PG,
yes.
specially created test for your college exams. So you will have that, you can actually spend the 2 years playing with the tests, and you have a test for almost every day wherever you need it. So test series, question bank, back to basics, live rapid revision. So these are the part of your B2B. Plus DVT access also is there with the B2B subscription as well. Above B2B will be TND, where you have a weekly TND also, but you also get everything that you get in B2B. And above TND will be the ultimate live, where every day a live teaching is happening. Plus
So
big
yes,
changes are
med
coming
study
up.
mate. is asking, is B2B notes and test series enough to get a three-digit rank? It is enough to get a top rank. It is not enough. It is the resource. I promise you, they will be the most updated. They will be the most easiest. And they don't leave you with confusions. ये भी हो सकता है, वो भी हो सकता है, पूरी कहानी कर दी मगर आंसर ही नहीं पता. Right? That's how lectures get lengthy. It's not like that at DAMS. At DAMS, we know what we have to give away as a message. We don't confuse our students. We give them a resource which they should feel confident about, that they can do multiple times, right? So you can get a top digit rank, but yes, use the combination, use the videos, use the test, analyze your test, and go back to your mistakes. And yes, not just a three-digit rank, top ranks. Okay?
And the new version of the handwritten notes is also going to be released soon.
Yes,
And also keep in mind, we are going to bring up lot of new updates soon. Be glued to the channel. You will see the future of medical education
yes,
happening,
there
future
is
of UPG
something big
professionals.
coming up, and we are excited to bring absolutely the new dams to everybody.
So
Chalo,
wish you all
we'll
the best.
see you. Okay, just to inform everyone, we would not be having the transform session tomorrow morning. So we will be seeing you day after tomorrow, 27th at 10 a.m. on Dams Delhi YouTube channel. And on 27th, you have the Obs and Gynae MIQ as well. So get set, go everybody. Let's convert our day into a productive day. Keep doing the daily targets. And here is wishing you a good productive day ahead.
So I hope you enjoyed the MIQ radiology yesterday, and I'm sure you will enjoy the Obs and Gynae MIQ coming up soon. So we wish you all the best. Have a great day ahead.